The quality group here at Sunrise consists of two teams. One, the quality assurance team, which maintains our quality management system, and the other, our test team, which is the engineers that take care of the majority of the verification activities. What makes Sunrise a little bit more unique in our quality system is that we allow ourselves the ability to adapt to a specific client's needs. So for the majority of our projects, we assign a quality lead, just like many other companies do. We also assign a test manager. Sometimes they're the same person and sometimes they're a different person. The quality lead often will handle many of the activities associated with documentation, making sure that the project is staying in compliance. We now started a program where we're doing quality audit checks within projects themselves so that we can make sure that we're maintaining what we've stated in our project plan. Test managers often lead other test engineers during the verification. Test managers are responsible for making sure that the protocols are complete, that they have been traced to the requirements, and then they oversee the testing that's occurring on the project.
In medical devices, quality is a very specific meaning. It has to do both with, are we meeting the commitments that we've made in terms of this is how something is supposed to work, as well as making sure that we're showing that a given product actually meets the needs of both the client and the patients involved. The Sunrise Quality Department has two main functions here. One is making sure that we have rules that are inspired by the federal regulations and international standards, and even European regulations that reflect how we are supposed to conduct medical device development. And the other is making sure that the devices that we are working on, in fact, meet the requirements, the agreed upon requirements, and that they work well. So for me, what's close to my heart is more, do the gadgets work the way they're supposed to work? Do they work well? That process is a process of encountering something completely new, looking at how that problem is being solved, and trying to approach it as a whole and figure out how basically to prove that all of the functions actually work the way they're supposed to work and that they work together in a consistent and effective manner. I think to be a good quality engineer, you have to have a little bit of a self-righteousness. You have to believe that something can be right and that you can know the difference between what is right and wrong, and then let that sort of inform how you're reacting to the project. It's really interesting to try to solve those problems about how to prove it, because that's really what we want to be able to do. We want to be able to show the FDA or some other regulatory body, printed on paper even, this is what we did, and this is why we know that this product is safe and effective. There's seldom quite the thrill that you get when you find a bug, like especially some of the hard to find ones.
Our job in the quality department doesn't end when verification is complete. We try to help our clients through the process as they're trying to do their submittal, whether it's FDA or CE marks. We're there to support them through that entire process.